Thank you very much, Prof. Tengku Ain. Um, that was a very interesting talk, and it's nice to hear about cells. We are from primary care, so we usually deal with humans, but from cells are where the humans and the community comes from. So today, our topic from primary care will focus on stakeholder engagement in research. We have with us Dr. Siti Nurkamilla Ramdzan, who is a senior lecturer and very important member of the department. She just completed her PhD few years now, actually, on asthma, childhood asthma, and her research interests are of respiratory diseases, non-communicable diseases, complex intervention, implementation research, and children and maternal health care. She is an advocate for children, especially those with asthma and other chronic diseases, and currently working on developing a national school guideline for children with asthma. Stakeholder engagement, as we all know, especially in research, becoming more and more important. It is to ensure that our research is relevant, impactful, and responsive to our beneficiaries' needs. Dr. Camilla, in this talk, will share her experience in engaging with different stakeholders in different stages of her research. Her aim is to improve the lives of children with asthma in Malaysia. So the title of the talk is Stakeholder Engagement in Research, Sharing Experience, Improving the Lives of Children with Asthma in Malaysia. I give you Dr. Camilla.
Thank you, Prof. Adina. So thank you for the kind introduction. So I'm just going to start. Sorry. All right. So I would like to acknowledge this research was actually funded by the NIHR Global Health Research Unit on Respiratory Health, which is called Respire. And my PhD work and is actually funded by them as well as my studentship. But there's also a disclaimer that the views expressed in this webinar is these are the authors and not necessarily from the NHR or the UK government. So what is stakeholder engagement? I think this is something which is not new, but I think there are more emphasis as well as what we trying to do is that so that stakeholder engagement is become more structured. It used to be, I think people think it is an option and it's more like this, especially for people who wants to get international grant. They always say it's the stakeholder research, but as something which is essential, and because people see that, working together with individual groups and communities across health and care system will actually maximize the relevance, reach, and impact on the research. So now we actually want research to be more, previously people do actually research. It's more research-centered studies. And we are moving towards doing research which is more people-centered, stakeholder-centered. So I think this is how we see the level of engagement with stakeholders. Previously, people just want to inform stakeholders. They just want to tell the people what they're doing. They just want to share what they're doing and just inform them. What we're trying to do now is actually involve and engage with stakeholder more. We want to involve them, and we're actually moving towards, collaborating, co-creating, getting support from the stakeholders. So actually, stakeholders and researchers have equal partnership in undertaking the research, and even better if it's actually stakeholder-led. So I think that is how we are actually moving from just informing stakeholder what we're doing to actually involving, co-creating the research together with stakeholders. So I'm just going to share with you how I actually involve stakeholder in my PhD work. The aim of my PhD was actually to develop a carefully tailored school-based intervention for asthma in Malaysia, and it's called Asthma in short. So there are 4 phases in my PhD. first phase was a systematic review followed by a qualitative study. And these two phases actually informed the development of the asthma program. And finally, I did a feasibility study. Um, for this webinar, I'm just going to talk about phase 2 to phase 4 because I think for the systematic review, that's not it's secondary data analysis. That's not much involvement of stakeholder in that phase. So this is the cycle of stakeholder and how we actually involve stakeholder engagement throughout my PhD work, even when we actually uh, doing, identifying, prioritizing the work, we actually did some engagement, engaging with the stakeholders to understand how we can actually do the research. During the development, we actually co-create developing the materials and how we actually going to plan to the feasibility study. And actually, finally, at the end, we actually had meetings to disseminate our findings as well as plan for our future research and planning. I'll actually discuss this further in talk. So in phase 2, we did qualitative study and we actually talked to students with asthma and their parents, and we found out that actually children had very little support if they have asthma symptoms or even if they have asthma observation at school. There's even stigma towards asthma, and there were children who were scolded for bringing inhaler spaces to school because teachers have not seen these devices and they think that these devices are toys. So that's why these children are scolded because you're not allowed to bring any toys to school. And children, and my study actually involved children in primary schools, and they are actually not competent. They do not know how to actually manage asthma on their own. So what they usually do is if they have, chest tightness, breathlessness, they just call their parents. In school, there are no parents. So what happened is that the teacher will call the parents and parents will actually come to the school to actually provide, to get the child to the nearest clinic or provide caregivers. So we know this is an issue because, delayed asthma treatment during symptoms and emergency could, lead to further morbidity, even death in severe cases. So we want to understand this more, and we actually talk to teachers, healthcare professionals, and policymakers. And true enough, teachers, they don't know what they need to do if a child has asthma symptoms, if they have asthma attacks. And we talk to healthcare professionals. I think doctors are aware of this, even like the school health team, they're already quite busy and they have a lot of programs that they need to actually um, deliver. And, having another program can be a burden to them. So they do agree that it's important. They also see it needs to be a simple program. When we talk to policymakers, there's also worry from them because they only see teachers' role as teaching, and they're worried that it's blame from parents about not providing good care with asthma because they feel that they are not trained in this area. So with those findings, we actually developed the Cut Asthma program, and we have because we understand there needs to be multiple people that we need to intervene. We actually have 4 target groups. So the first group is actually children with asthma and their parents, and the aim is actually to improve asthma self-management skills and practices. We actually want to educate the school teachers on school asthma action plan. We want to train them, provide care for children when they are at school, as well as for all school children is actually to improve awareness and reduce stigma towards asthma. Hopefully by having these different target groups, you could actually improve asthma care at school as well as improve asthma control of children. So we actually co-create the key elements of the program with the stakeholders. And for example, we had these posters and audio audio voices which we play in the system of the school. When we actually design the poster, we actually used images of cartoons. And we wanted to show to the children so that they could understand. And when we actually shared with them, they actually preferred images of real children rather than the images. So as a researcher, I thought that children would love, cartoon images, but actually children were able to relate to the images of another child, and they see that it's either themselves or a friend having asthma rather than a cartoon character. So if we do not actually do or engage with the children to co-create this material, I think we maybe it was not as successful as it was. So I think it's important to have this, even for the voices that we play system of the school. We actually use children's voice, and I think it's very refreshing for the children, and children are very interested to hear suddenly children's other children's voices in the PA system, because usually it's just the teachers and adult voices. So it is something that we learn from the children. The second key element is the generic asthma action plan. So from evidence, actually, and even in developed countries, they use personalized asthma action plan to be used in schools. But when we actually conducted the qualitative study and also discussed with the teachers, it's not possible for teachers to provide personalized asthma action plan to children. So we developed a generic plan, which was adapted from the PAP. And actually, even for the warning zone, in many developed countries, teachers are actually quite um, confident in providing, supervision of the use of inhalers and the use of SABA or asthma medication. And what happened is that teacher would actually after monitor, and they do not even call the parents if they think that the child is okay after the use of inhalers. But in Malaysia, because the worry and the teachers are not comfortable to do this, the warning zone is actually designed so that the teachers would supervise while waiting for the parents to come. So I think again we were not able to do this if we actually try input from teachers as well as other healthcare professionals is very important. The third key element is the creation of videos that we use to aid delivery and disseminating our message. And this again was actually co-created with children. So we had like I'm not going to play the video, but we have children acting in the videos, and we have a story so that the children could read it. They also provided some ideas how we can actually do this. So I think again, other children, when they see children acting in the videos, they are more interested. It's more interesting, and they could actually relate to it better. Even for adults, I think it's quite, interesting to see how children act, although it's not easy, but I think we find it is very interesting, and I think it can, you know, bring our message better than having just adult talking or adult acting in the videos. So we did the feasibility study trying to actually deliver the program that we've actually developed. However, because of COVID, this was actually in 2020, we're not able to conduct this plan. So as you all know, school was closed in 2020 for quite a bit. And when school was open, we actually tried to deliver the intervention. It was done halfway. So we were able to actually did the face-to-face session with the teachers, and we had good feedback from it. However, school was closed, and we had to actually adapt the program from being delivered face-to-face to online. And we did this for the parents and children with asthma. Um, I think the problem was that some children do not have devices, and this was not actually done in Klang Valley. So there are more children who are not able to actually attend the session, which was the issue. But those who attended felt that the session was good, and they received again good feedback from them. We were not able to actually deliver the session for all school children. So yeah, we hope to actually do that in our next study. So this part is where we've done the study. We're actually now sharing our findings with the stakeholders. I think previously, as researchers, we are only focusing on sharing our findings through publications or just like webinar talks like this. But I myself, previously, I've not done this before, where we actually share with the stakeholders on the findings that we actually got. So because I think one of the requirement again from NIHR is actually to do this. At first, we are just doing it because of the requirement, but later and now I actually see the benefit of doing it. Actually, has a big impact. So we meeting with parents, school staff, policymakers. We actually have, we insert the findings of our study in workshops. We also have it in newspapers. And actually, by doing this, we actually were able to actually have our presentation of our research to the Deputy Minister of Education. And this work was actually, we had received a good feedback from them, positive feedback. And now we are actually going to develop a regional school asthma guideline. If it's difficult actually to go to the Ministry of Education and to actually do this kind of programs. But I think being able to talk to them during this meeting and using the qualitative study was very powerful. We also actually disseminate our findings with the children. I think for children, it's quite different how you actually do the dissemination work. Has to be very interactive, lots of play, and we involve the NGOs. We also develop a school activity book for children, and these are the children who are involved, and we're going to use it for our future research as well. So I think there are a few key learnings from the engagement. So from the qualitative study, we found out that it's important to keep the program simple but practical. And it's important that we involve, different social network of the children. We also identified misperceptions in the community that we actually which inform our development. In development of the program, we actually co-created the materials, and as well as we also actually involved this school staff, health professionals, actually design our feasibility study. And lastly, during I think this dissemination, we know that it's very important, and it could actually inform our future work as well as implementation. So I think there are a few tips for stakeholder engagement. I think we need to plan this activity, not just by the way, but it's actually part of your research work. We need to be flexible because, when you meet with different people, there are different priorities that they have. So you have to try to accommodate to the people that you work with. And when you collect, the information, it has to be gathered systematically to meet your research objectives. I have to admit that actually when we did this, it was not very systematic. Um, I mean, for our future research, we have aspired to. We are learning from it and we are trying to do it much better. So lastly, I think it's also important to recognize that engagement with stakeholder is an iterative, ongoing process. It's not just one-off thing. You have to continuously involve the stakeholders in your research throughout the different phases. So because you have many stakeholders, you want to know, who do you want to have contact more? Who do you want to engage more? I think this table here is actually quite useful. You want to know whether these people have high influence or not. Policymakers, are very highly influential, and you want you want to engage with them often. But I think the tricky part sometimes they do not have high interest. So by engaging with them, you hope, they will have higher interest. Those with high interest, definitely you want to keep them, although they may have low influence. People who have low interest and low influence, it's okay for you not to engage with them so frequently. You just have minimal content, that's fine. Last but not least, I would just like to say about the strength of qualitative research. I think people underestimate the strength. Because, for example, most of my PhD work is on qualitative study. I use qualitative methods. And actually that is a good type of it's a good powerful tool actually for me to actually engage with stakeholders, for me to understand their views and opinions. And also you can actually create that relationship and networking for your next studies. Also, for example, school-based asthma program is actually already, it already is quite, there's already evidence to it. It's already Cochrane review. WHO is already recommending this program in all countries. However, we don't have the local evidence. And for you to develop a local program, you need, qualitative study for you to design it. And it's a good, actually good storytelling way for you to actually share with your stakeholders so that people understand and people actually could relate to this qualitative study rather than some quantitative study. So do not underestimate the skill of qualitative study. I think it's the end of my talk. You could email me, see mail if you want to know more or you want to collaborate you know um with me. That's all. Thank you.
Thank you very much, Dr. Camilla. That was a quick introduction, I think, to stakeholder engagement, although I think the last few slides are very important in terms of categorizing your stakeholders, whether they are high influence or high interest. I think that will give you a better idea of who to spend your time and resources on. I think some of the challenges with stakeholder engagement is that the time and resources put in are not commiserated by the time and resources reciprocate by the stakeholders. So it seems very one-sided. Prof. Tengku, are you there? I wonder, I can't see any questions in the Q&A.
Hi.
Hi. But can you see any question? I?
No.
No. Okay. And I think it's 901. Shall we close it, Ain?
Yes.
Yeah. Okay. I think it's a shame because I think Sam should have taken the whole hour because I would have listened to Sam. Maybe I think Sam has another sessions as well. So I think those who are interested in the work, I mean, it's a fascinating work. Should definitely spend more time with Sam. So I think that's all from us at Primary Care. Ain?
Yep. Thank you very much. And that's all from us, also from the ophthalmology.
Okay. See you all next week. Thanks, everyone. Bye.